Okay, here's my microphone. This is take 2 of my vaccine rant. Okay, let's go. Whoop. From the top. Vaccine hesitancy. So what inspired this rant was I went through probably like an hour-long discussion with some comrades talking about bodily autonomy and conspiracy theories and why people have issues getting vaccines. And, like anything, whenever I have a strong opinion, I experience doubts. So I still find it very easy to inhabit the opposite position and sympathize with the doubts on vaccines. There are a couple of reasons why I sympathize with the distrust in the medical industry, but a big one is I personally have not had a great experience with the medical system. I don't want to underrate my medical problems. They're relatively garden variety though, like depression and ADHD, stuff that isn't literally crippling. I've had a really hard time with doctors though. You think that would be really easy for them to understand and deal with because it's so common, but I get that people have had bad experiences and they feel like if it's not broken, they don't want to fix it. They don't want to risk going to see some expert that might be an expert but who doesn't really care about them. I sympathize with not wanting to trust the experts, which is kind of just like the big liberal line right now. And at the risk of sounding like an anti-vaxxer, I've learned to do my own research when it comes to mine and my loved ones' health care. I have decided what I want from a doctor a lot of the times when I go see them, and I look for a doctor who cooperates with me and treats me like I know what I'm talking about. So when I go through this, I look at medical research, and there's a difference between not trusting the medical establishment and not trusting medical research. In my amateurly educated opinion, vaccines are some of the simplest and most easy to understand medical science out there. And so it's a very important preventative medication. While we were discussing in my meeting, we were talking about what to do with anti-vaxxers, like do you sympathize with them? Do you try to work around them? How do you try to convince them? We went through this, and because there's so many facets to this issue, at no point did we thoroughly discuss the overtaxed medical system. But there are stories like in upstate New York, they're letting go all of the nurses who will not get a vaccine, and they anticipate not being able to staff their maternity ward at the end of September. There are so many nurses who are not into vaccines, they can't even staff their maternity ward. That's incredible. I was shocked that working class people, the nurses who have to bear the workload for the people who get severe COVID infections, they have medical education. They are experts. They're not doctors or researchers, but they have to deal with the consequences of people not vaccinating. So, from my perspective, the nurses who decide not to vaccinate are some of the experts making not great choices. If those nurses had not been let go, they would be more likely to pass infection to their patients. But without them, we don't have enough people for the maternity ward in New York. So experts might not give you great care because they are biased. So that's a reason why the average person would not have a great relationship with the medical system right now. And why vaccines are also really important. The person who declines to vaccinate, if they get COVID and have severe symptoms, there's a great chance that distrust will continue. But if they get severe COVID symptoms, they will probably still decide to go to the hospital, where the ICU units are already crowded with COVID patients who are usually unvaccinated. So if you can't trust the medical system with the vaccine, then you put yourself at risk of not trusting the medical system with more invasive procedures like getting intubated. If you don't trust the system to vaccinate you, then you shouldn't trust the system to treat your severe COVID. If you can get in and out of a flawed system safely, it's going to be way easier to do so in just getting vaccinated than if you have severe symptoms. I think that's an issue with the medical system, and there's a lot of issues with the medical system, and it's overburdened even before this COVID thing came along. It's never had enough resources to treat everybody well, despite the amount of money that goes into it. Unfortunately, I think that's a big part of why the publicly funded approach gets so much suspicion, because people always see so much go into the system on their bill, and they can't imagine having it additionally funded by taxpayers. They can't imagine having it expanded and centrally planned. They can't imagine that if that happened, that would improve the system. They don't want to sink any more cost or develop a thicker bureaucracy around something that is currently not meeting their expectations anyway. So I couldn't imagine all the details of what a better medical system would be, but I know that in general, people have better health outcomes and better satisfaction in a single payer system. Currently in the United States, I think that the insurance companies are already responsible for a lot of the problems that we'd hypothetically be concerned about the government introducing and expanding upon. If you're concerned about throwing good money after bad, the insurance companies have already gotten there. That's part of our distrust in the system that exists. The way that insurance companies have titrated care, there's a lot of research going into stuff like sports medicine so that people who are in private profit industries can get their star players repaired and out on the field right away. And it's just like a dumb trickle-down type of apparatus that a new medical technology that repairs a footballer's ankle or a hip to get that technology to the point where it can be available to your grandma is just not good enough. There's less profit in fixing grandma's hip than there is in a multi-millionaire football star. So when the medical research and the insurance companies are designed for profit in mind, that creates a system that's hard to trust. On the other hand, the American neoliberal culture in general, but especially the avid pro-business perspective, experiences a lot of cognitive dissonance because they expect capitalistic enterprises to be more efficient when they are motivated by profit margins. So there's the dissonance from the neoliberal pro-market perspective because markets are supposed to make things more efficient through competition. But the insurance companies are inflating prices of services and products, making a lot of money off of not treating people well. So what we have now is kind of the worst of both worlds. Not only does the profit motive exist, but putting on my devil's advocate hat for the capitalists, the insurance companies interfere with competing that theoretically the market is intended to do. Right now, the medical insurance companies are paying for bureaucracy that denies and avoids good coverage. There was a really good meme going around that said something like socialism is the fire truck coming automatically to save your house to put out the fire, but capitalism is the insurance company denying your claim. On paper, in the imaginations of proponents of capitalism, neoliberalism, and competitive markets, I'm not sure if the best vision for all of this has to involve so many shitty insurance companies, but in reality, we have a system where we are advertised medications that we can't even choose to buy, we have to ask our doctors about. So, hypocritically, the reality market situation existing now fits the classic critique of communism. Good on paper, but shit in reality. In reality, it's inevitably corrupted by a system which only serves to benefit a ruling class. So, can the ideal capitalist market exist? Back in the day, there used to be a lot of Ron Paul fans, and he was a doctor. He would say that a market without regulations and insurance companies would be better for healthcare, and I really disagree with that. It's such a hypothetical scenario that I was willing to entertain it back then, but Ron Paul is obviously not the right answer. He's got a lot of dumb ideas. He doesn't even like currency or fiat currency, but that's a digression. It is a question in my mind, But I think it makes the most sense for the system to be centrally planned and not left to competitive markets. But plan B, if we have markets, if we had a hybrid socialist system that has markets and a Medicare for all plan, then the markets could be forced to compete with the level of care provided by the publicly funded system. That would allow the privately funded healthcare to be limited on how bad they could be, because if the public system is better, people could easily abandon the private system. And I think if we tried such a hybrid system, the private sector for healthcare would wither away. When I recorded this live on my first take, I got a take from the chat. Free healthcare isn't that great in Canada. It takes forever to get a checkup. I was on a list to get the second vaccine for over 3 months until I went to a private clinic. So thanks for that anecdote. I looked at healthcare in Canada a little bit. I've seen good stories and bad stories, but I haven't done enough research to really make a synthesis of that. However, there's nothing in Canada when it comes to bad stories that seems unlike the United States and the private system we have here. In both situations, there seems to be a real accessibility problem where finding good appointments can be difficult and involves a lot of waiting and red tape. I waited so long to see a psychiatrist. I've waited so long for specialists. I've kind of started to improve on my own without help. I have a lot of issues with executive dysfunction and with doing paperwork and phone tag required to get medical appointments. Struggling with those tasks are why I wanted to get medical treatment in the first place, so that I could get ADHD medication that can help me navigate a bureaucracy. The last time I got close to waiting for a psychiatrist, I was going to have to wait for like 3 months in a big city, and that was in 2017. That was the waiting list the last time I played a bunch of phone tag and got close to getting on the list. Obviously, it didn't work out. A psychiatrist shouldn't be a super rare specialist. I'm not trying to use pills as an example of something everybody should do. I'm not saying everybody should go on pills when they have trouble with bureaucracy, but I'm saying I wanted them due to the extent of my problems, and that's a specialist I wanted to see, and I couldn't. More than 10 years ago, the last time I had regular psychiatrist appointments, I lived in a town with like 200,000 people, and they only had like 2 psychiatrists in the whole town. So if you have an autoimmune disorder or something rarer than ADHD in America, seeing a specialist for that is like impossible. And when you're waiting for a specialist in this country, you also pay for the privilege. In Canada, I know they have waiting lists for specialists. I don't know if they rival our shortages, but either way, it's not great if you have to wait that long. But in Canada, with the healthcare system there, you don't have to put the same amount of capital behind that disappointing experience. They don't go bankrupt with medical bills when the government is responsible for the costs and investing in the health of its citizens. That's kind of a sad mitigating factor. Yeah, both of us are waiting, but one is paying for it. But I think it matters. My other idea for the medical industry, and this is not a popular idea, but I do think people who treat patients should be educated well. But like the amount of education it takes to become a specialist in the healthcare industry, I mean, 6 to 12 years or even more, it's a lot. It's a lot to even be able to fund alone, and that's part of the doctor shortage. That's a lot of money, but if you're in a residency program, there's a lot of really long shifts. It filters out disabled people who can't work for 12 hours straight, and disabled people should be working in the medical system. They have inside knowledge of what it's like to be disabled. I've never tried to be a doctor. I've tried to get jobs in IT and other fields. The amount of gatekeeping in even a field like IT is insane. There should definitely be more gatekeeping in the medical industry than IT, but I cannot imagine that medicine is exempt from the general trend that there is so much extra work involved in acquiring the qualifications because the profit that is extracted from the students and other steps on the ladder, not just profit, but free labor because of the hours and hours of clinical experience needed before the person being trained is rewarded with a career. My very amateurly educated gut feeling says that the amount of specialists and doctors are way short because it's exploitive to train them. The amount of time and energy it takes, which is only generating debt for the person being trained, and all the people higher up than them are taking advantage of the people just trying to work toward a good career. That makes it hard for people to get through. There's been some hacky workarounds that have become more of a thing, like to make up for psychiatrists today, you'll see more nurse practitioners doing med checks so they could write prescriptions instead of doctors. Or in the clinic, you'll just see the psychiatrist sometimes and the practitioner most of the time because it's easier to become a nurse practitioner than a psychiatrist. And this is a more reasonable level of education for the routine work of a clinic, at least than becoming a doctor, but still probably not great. My other suggestion is to allow more patient freedom in acting for their own care. There are, I think, a lot of prescription drugs, and we're going through a prescription epidemic when it comes to things like opiates. But there are other drugs that I feel are, if they maybe aren't harmless, they're at least less harmful than Tylenol, just as an example. And it would be good if somebody could grab something like antipsychotics without having to get permission from a doctor. I think that there are some more choices that people can make for themselves, choices that are not currently options right now. It kind of cheeses me off having this vaccine debate when I don't really see a lot of personal choice and autonomy in medical matters at all. The amount of medications and simple treatments that people could be educated enough to determine for themselves is really big, I think. We've become so used to this patronizing, hand-holdy culture that it blinds us to the possibilities. I've read this take out in the wild a few times by different medical experts that when it comes to Tylenol in particular, it's a risky drug. Most people can take it and be fine, but if you have chronic pain and a reason to take a lot of Tylenol every day, you're going to be at risk for developing kidney problems. And this is an actual common overdose situation, taking too many over-the-counter painkillers. I've seen doctors in the media saying they believe that the FDA would not approve Tylenol for over-the-counter use in the modern era. We're used to taking Tylenol. We don't take it without risk. People do get injured because they take too much and they don't know how dangerous it is. They take it for granted that it's safe because it's over the counter. But actually, especially when it comes to things like dental problems that aren't treated when people are not covered with dental insurance, so they start taking all of this Tylenol, and it's not uncommon for people to end up in the emergency room with cysts. For us to be able to use OTC painkillers and alcohol has many genuine medical uses and also many side effects and problems. These are things that we're habituated to. But the idea of just deciding to go on Prozac without asking your doctor for permission, everybody's going to freak out about it. But I don't think it's unthinkable. And the limit on how much we could decide for ourselves would be determined by the amount of publicly funded and accessible education that there is. You know, we could have PSAs on TV telling people how to use the most common types of medications safely. We could have education to people who just want to know and aren't looking for a career. And the doctor could be there for you if you felt unable to make a decision for yourself. I've been on Prozac before, and if I wanted to get Prozac again, if I could pick it up off the shelf and take it every day, I think if that happened, I would be fine. So to go through this situation where we're like, I don't want vaccines, it's my body, it's my choice. They're appropriating abortion advocates, for one thing, as if I have any choice for what I want, like go get Prozac when I want to, or go get an abortion in Texas. It seems like a weird double standard to me. Overall, the lack of advocating for freedom. Medical marijuana is a big deal. People are finally starting to come around, but that's not something we can take for granted. We're really entitled as a culture to be able to tell others, don't do drugs. If you don't want to get pregnant, don't have sex. Don't do things that aren't good for you. Wait for permission to do what is good for you. And the freedom to make our own choices medically is just absent until we're talking about the freedom to not do vaccines. It really boggles the mind that that's where we're taking a stand. I think that is shitty. Really just seems like anti-medicalism in general and not a weight or measure take in favor of personal autonomy. That's kind of how the cookie usually crumbles when it comes to these political issues that I'm interested in. There's a take against vaccine mandates, which I can relate to, but when I look at the attitude towards personal autonomy in general and how that affects me, it's rather selective, and the mob mentality seems to be selecting irrationally and usually to our disadvantage. That's the end of my script. I hope you guys enjoyed that, and thanks for watching.